Wear the Gown. Brought to you by CHI St. Vincent.
School has started, and for some kids, this is a stressful time of the year. And that can have some painful repercussions. It may be hard to believe, but for some of you watching right now, it was really hard for Mr. Reading Road Trip himself, THV11's Craig O'Neill.
And they always refuse to do their lessons.
I read to kids on a regular basis, and it's tough to think some of these kids get headaches on a regular basis, but they do.
I think part of that goes back to the myth that children don't have headaches or that they use headaches to get out of things that they need to do.
That's Dr. Joe Elser, who heads up the Pediatric Headache Clinic at CHI St. Vincent.
Conservatively, 20% of kids have headaches, and I think it's probably higher than that.
And where do the kids' headaches come from? The family tree.
If you are predisposed for headaches with the headache gene, anything that throws your body out of whack can be a trigger.
Bad sleep habits and normal everyday stress are triggers. It can happen with weather. All ages are affected, but the largest segment is teens.
And once you hit the teenage years, it tends to be like the adults. It's a 2-to-1 female to male ratio.
But when do you bring a kid into an examining room like this one? Answer: when the problem interferes with life.
And my rule of thumb is if you have more than 1 or 2 headaches a week on a consistent basis, it's time to have the headaches evaluated to make sure there's nothing wrong.
But the clinic has a long history of children who get them more than twice a week.
3/4 of the patients we see for headaches have headaches every day. And you think, kids have headaches every day? Yes, kids have headaches every day.
Special thanks to Dr. Elsa for taking time to point these things out. It's his busy time of year.
Headaches always increase during school.
So now you know. And remember, wait, there's something else Joe wants to say. Joe?
Everyone I've ever seen the last 32 years for headaches has been to the eye doctor first, thinking vision problems cause headaches, and it doesn't.
Okay, good to know. If your child gets them, there's a clinic waiting on them. Here's the good news.
The fortunate thing with headaches in kids is they are almost never something serious.
And we realize that there is a chance of severe headache being something more serious. Dr. Elser tells us, though, if the headache is here today and gone tomorrow, you're okay. Your kid is okay. For chronic headache prevention and myths surrounding headaches in kids, head to our website, thv11.com.
Oh, I remember those headaches as a kid. And you know what it turned out to be?
What's that?
I needed some glasses.